Welcome back to Behind the Headlines. You might remember from the COVID pandemic that vaccination is the best way to achieve herd immunity to keep a disease or infection from spreading rapidly. To protect against a measles outbreak, the vaccination rate needs to be 95%. It is not that when it comes to kindergartners in Missouri. Annalise Henshaw with the Missouri Independent News Service joins us with more about this. And welcome back, Annalise. Always good to see you.
Yes, thank you.
Okay, so what is the current measles vaccination rate for 5-year-olds, and why is that worrisome?
Yeah, so according to the Missouri Department of Health and Senior Services, we are at 90% for last school year, the school year that ended in May. And that is worrying experts because it's down 5% in 5 years. So we're showing a very negative trend.
So where does Missouri stand in terms of non-medical exemptions, and is that what scares doctors across the state and also the CDC? And could you give us some examples of counties in the Ozarks?
Yeah, so in Missouri, we have a 5% non-medical exemption rate for the kindergartners last year, and that is above the national average. So we have more people with exemptions. And this is worrying health experts because we have some counties where like Cedar County has around 74.4% vaccination rate for the vaccine that protects against measles. And we've already had measles cases in Missouri, and 5 of the 7 confirmed measles cases were in Cedar County.
So there is a connection. So besides measles, what other childhood vaccines are being skipped, if that's a fair word?
Yes. So the rates for all of the scheduled vaccines have been decreasing. Also notably, the one that protects against whooping cough has been going down around the same rate as the measles vaccine. So it is kind of across the board.
Were you able to, or has the Missouri Health Department able to distinguish whether these children are homeschoolers or in their public schools yet, or preschool?
They do separate public school students from private school students in their dashboard. There's some counties where there are not enough private school students to share that data because it's such a small group of folks. But the private school kids are more likely to have exemptions and have lower vaccination rates than the public school kids at this moment.
So do the experts that you talk to for your report think that the hesitation about vaccinating their children comes from misinformation?
Yeah, it's definitely part of the equation. We had a family health doctor here in Columbia. She is an expert on vaccination and has done like a big extra program with vaccination. And she told me she's been seeing a lot of patients with, these false facts that are worrying them. They'll come in and say something about the vaccine that's just not true. So it's definitely fueling it, but it's not the only thing.
Also, does government funding cuts or funding per person have an impact on vaccination rates, or will it in the future?
Yeah, the Missouri Rural Health Association said access is a big part of the problem as well. So it's not just hesitancy, but Missouri, I actually found out in my research, is the lowest state for per capita funding of public health measures.
Oh my.
And yeah, it's only getting worse nationwide with cuts at the federal level. We lost the Missouri Immunization Task Force, which was studying vaccine hesitancy at the time that they were cut.
Do you know if there are any campaigns in the works, for lack of a better phrase, by the state health department to improve vaccination rates?
I'm not quite sure what state health officials are doing, but at the local level, I know in Kansas City, they have been expanding their hours, going outside of work hours, so then families can come in after parents get off work and get help and get their kids vaccinated.
Sure. All righty, we will leave it there for now. We've been talking to Annalise Henshaw with the Missouri Independent. You can see Annalise's reports online and on social media, as well as other Missouri Independent reporters, as this conversation on KY3.com and the KY3 News app, also Roku, Fire TV, and Apple TV+. Annalise, thanks very much for the information today. We always look forward to next time, and take care.
Thank you.